I would like to tell you a bit about sciatica, because this is very common health condition which I treat here in my physio room. So, what is sciatica? Sciatica is compression on the sciatic nerve, which goes here through piriformis muscle. And here would be good to emphasize one thing, that we need to distinguish between true sciatica and fake sciatica. True sciatica is in this situation when the nerve is compressed due to misalignment here in the back. And fake sciatica is when a sciatic nerve is compressed due to tight piriformis muscle. And this is important to know with which we're dealing, because the treatment is a bit different. So if we're talking about sciatica, so the reason of the symptoms, it's misalignment of the spine. I could say that it's misalignment on lumbar spine, but it's usually all connected. So if we have a lumbar spine misalignment, so it's not that it makes sense to focus only on this area, because body compensates and changes this curve above. So basically we need to work with a whole skeleton and fix everything what is out of place. So how we distinguish if it's fake sciatica, so piriformis syndrome, or true sciatica? We just do examination, and to confirm that it's true sciatica, we do, for example, LASIK test. So the client is lying on his or her back, and we passively, as a therapy, lift a leg towards 90 degrees of flexion in the hip. If it's the problem, if it's sciatica, so usually it's enough 20, even 30 degrees, and symptoms occur in lumbar spine of the client or along hamstrings. And if we want to find out if it's piriformis syndrome, so the client is lying on stomach, legs are together, then we bend legs in the knee, and feet go to sides, and then we check if it's less than 45 degrees. If it's less, so the legs, for example, like this, so about 10-15 degrees, so we know that this muscle here, piriformis muscles, which is about here and here, it's very tight, and the sciatic nerve is compressed due to tightness of this muscle. Very common sign of tight piriformis muscles is the way of walking, which is very with feet to sides, and then we know that it's tight without even examining this, without even touching the muscle. And this is really essential thing to distinguish sciatica from piriformis syndrome, because as you see, it's a different way of treating a client with this two different conditions. Usually it's combination, so or it might be both. this and this, and we just combine the treatment. So we work with bonds to put bonds in place. It's not one treatment, I will tell you straight away. It's like, I really like this comparison with treatment of teeth when you go to orthodontist, and it's not just one appointment, it's just like 1 year at least, I guess, of time treatment duration. So you need time, body bonds need to transform and change position to come back to how it should be, so to physiological setting. And I should start from sciatic nerve, maybe a bit more information. We will be it's about I'm about to finish, but at the end of this video, just think about sciatic nerve. It's this yellow root. It goes from below L5, S1, S2, sometimes S3, and sometimes L4. It's big nerve, the biggest, the thicker in the whole body, 9 millimeters. And also it's not narrow at all, it's 1 and 5 centimeters. So it's big nerve, and if it's the condition, so unfortunately we have pain in glutes, we have pain along leg, even up to foot. Then when we I treated, so symptoms should centralize. So if the problem was even in the foot, so it should disappear from the foot and be centralized, what is a good indicator of the therapy. And in the next video I will tell you how to treat sciatica. Thank you for watching.